Thank you, Debashish. It's really a homecoming to me, and what a pleasure to have our WPA president, Afzal, and a lot of luminaries. And I can say obs- Debashish does have obsessive compulsive symptoms once in a while. Once in a while, symptoms once in a while. So anxious to see that all of us are comfortable and all. But for 3 days having public mental health and hearing from varieties of speakers across, it was such a new learning for me. Achal, I'm seeing you here after a long time, for the first time in a conference, so, and my own friend Shekhar. Dear friends, I think this is wonderful, and yesterday's dinner especially has brought a lot more memories. Thank you very much.
Yeah, yeah, any student.
Thank you, Siddharth.
Yeah, yeah, yeah.
Good afternoon, everyone. So I'm one of the PG students who could get, this was my first conference in psychiatry. So my opening into the conference world was fantastic with this, like this conference, and as well as the symposiums, the list of symposiums were very, very informative and helpful. And the quiz was fun, very fun. So thank you so much for arranging this and helping us with, like, ushering us into this world of psychiatry with such amazing event. Thank you.
Thank you, sir. Thank you, everybody. Now I propose a vote of thanks. It's very difficult to thank each and every individual who are associated, but let me first thank all the registered delegates, all the invited faculty, and all the speakers and all the chairpersons who came and made this program a great success. And next, I would like to thank our department faculty members, each and every JR, each and every senior resident, nursing students, nursing faculty, our HA and SA staff, support staff, and all the support staff from the media personnel, and all the audiovisual support staff, and even the catering, and also the industry who supported us. So I would like, yes, sir. Mariwala Health Foundation, sir, because they are also integral part, and also the students who participated too much in the art exhibition, and also the students with or the children with mental illness who also participated by painting various art, pictures, and who was, so indeed it's very difficult to thank everybody because so many people are associated in this conference in some or other way. And it was very difficult because we have been organizing it since almost 8 to 9 months. So we are always thinking that kab aayega din, kab aayega, kaise hoga, kaise hoga. Now this almost the end, and so if anything bad has if we have done any type of problems in executing any of the program, then kindly pardon us. And we would also request that keep visiting PGI, keep Department of Psychiatry, for all its CME or conferences. And we expect that we will meet each one of you in any other conference if we again plan. Thank you all. Sir, thank you, sir. We'll close. Okay, sir. We close this session. Now we will wait for a few minutes to start the Professor NN Wig Oration. Good afternoon, everybody. We'll be starting the Professor NN Wig Oration. May I request Professor Basu sir to escort our Dean and speaker of today, our guest, Dr. Afzal Javed, to the dais. I will request Dr. Devika to present a bouquet to our speaker. Dr. Jyotika to our Dean, Professor Naresh Panda. Dr. Ipsita to our head, Dr. Devasis Basu. And Dr. Devika to kindly. I will request Dr. Basu to hand over a bouquet to Mr. Siddharth Wig. Now may I request our Dean, Professor Naresh Panda sir, to kindly address the audience about the NN Wig Oration.
Good afternoon. Professor Afzal Javed, the orator for the Dr. NN Wig's oration today, Professor Debashis Basu, head of the Department of Psychiatry, Professor Hada, former head of the Department of Psychiatry, Professor Savita Malhotra, former head of the Department of Psychiatry, Professor Ajit Awasthi, former head of the Department of Psychiatry, other faculty members, the delegates for this conference, ladies and gentlemen. It's my proud privilege to welcome all of you to the Dr. NN Wig oration today. I knew Dr. Wig courtesy my teacher, Professor Vayan Mehra. He was Yogendranath and he was Narendranath. Both of them were very close friends. And when I was finishing my senior residency in 1990, Sir was working in All India Institute of Medical Sciences, and Professor Mehra asked me to deliver a packet to him, asking me, would it be really inconvenient to you? I said, no, sir, I'll go. He was at a distance. Sir had already told me that it might take you some time. Delhi, the distances are very long. I went to him. Those days, there were no telephones. The time was already fixed by Dr. Mehra that you go there. Dr. Wig will wait for you, say around 6 o'clock. I went there, and as it is said, the greatness of a man is known by the courtesy by which he treats lesser men. And Sir was so hospitable. He took me in. I was really reluctant. I was a senior resident. He was such a great man that time. He asked me to have dinner and then go back, and I said, thank you very much, sir. And after that, for many occasions, social occasions, I used to interact with him. He was full of knowledge, full of wisdom, and full of great general knowledge. I mean, he could interact on any subject whenever you could speak to him. So this was Dr. NN Wig, who did his MBBS in 1956, finished his MD in internal medicine in 1958, went to UK for his fellowship. The fellowship was Rockefeller Foundation Fellowship. And having finished that specialty training, he came back to PGI Chandigarh, joined as a faculty member in the year 1964. Subsequently, he became one of the youngest heads of departments in PGI at the age of 38 years. He founded the Department of Psychiatry and then continued in his pursuits, went on to join All India Institute of Medical Sciences as head of the department there, and then thereon he joined the WHO for a few years. His contribution to the world and Indian psychiatry has been remarkable. He was an astute clinician, a keen researcher, a great teacher, and a visionary leader. To his credit, there's a term called Dhatt syndrome, and made seminal contribution in research in the area of nosology, culture-bound syndromes, course and outcomes of psychosis, psychotherapy, and psychology. The community mental health program, which he initiated in Ambala, in Raipur Rani district, eventually generated the model for the national mental health program. He had many honors to his name, to his credit, and one of them was an honorary fellowship of the Royal College of Psychiatrists, a rare honor indeed those times. So, ladies and gentlemen, thank you very much for having made it to PGI Chandigarh for this oration. And I would welcome again all of you, including the orator, Professor Afzal Javed. Thank you very much. Good evening.
Thank you, sir. May I now request Professor Devasis Basu to kindly introduce our speaker for today's oration.
Thank you very much. Ladies and gentlemen, it's a very humbling experience to be here with Dr. Afzal Javed as this year's orator for the 6th Professor Wig Oration. Professor Wig Oration was instituted when Dr. Ajit Avasthi, our former head, my teacher, was the head of the department in 2018. Unfortunately, and the first orator, I think he should be still there unless he was. Sorry, Dr. Professor Srinivas Murthy. Professor, please come in front. Professor R. Srinivas Murthy, who is sitting at the very back, I don't know why. Please come. There is a space here. Oh, okay. So he was the first speaker, he was the first orator in 2018. And at that time, it was, sadly, we missed because Professor Wig sadly demised on, in that year only, just a few months prior to the first Wig Oration. But since then, the tradition has been going on, and we have, amongst other people, 2 others who have already delivered the Professor Wig Oration, Professor P. Kulhara, our head of the department, and Professor Savita Malhotra. We have also had in the past Professor B. N. Gangadhar, then the director of NIMHANS during the full COVID pandemic time, the first online presentation. And last year we had Dr. R. Tara, the famous director of now the president of the Schizophrenia Research Foundation. So this time again, we have Dr. Afzal Javed, who is the president of the highest and the largest body of the psychiatric associations of the world, psychiatrists of the world, that's the World Psychiatric Association, WPA, and a wonderful person. I think president, consultant, clinical associate professor, worldwide connection, network throughout the world, all these things one can speak. So I'm not using, sir, your CV here. I don't want to stand between the oration and those kind of things. But all I want to say is that here is a person with a golden heart, does not have any kind of show of the weight which he, the prestige which he commands, but at the same time is very easily with all sections of society, all aspects of the psychiatrists and other mental health professionals, workers all over the world. It's been a pleasure to have you here throughout the conference, throughout the 3 days of the Diamond Jubilee Conference. He has been active from day 1, and I think I must stop here now. I'll have to leave the dais to you, sir, for the 6th and Wig Oration. Clap for them, please.
Sir, please.
नहीं शुरू से कर पीछे नहीं पीछे पीछे Good afternoon, Professor Basu, respected Dean, past head of the departments of PGI, distinguished colleagues, senior colleagues, and dear trainees. I don't have words to say thank to Professor Basu and the organizing committee for inviting me for such a prestigious talk. And I honestly thought many times, am I really worth of it? I may not be a scholar of Professor Wig's status, but I can say one thing. I am a humble follower of Professor N. Wig, and I knew him from mid-80s. So it's about plus 40 years that I have interacted with him. The height of my relationship with Professor Wig goes to the time when he visited Pakistan and I took him to his native town, Gujranwala. I can't believe how this great man was expressing his emotions when he was passing through the streets of that city where he grew, where he had his education. And after that, he always saying to me, thanks, which I have not done anything. But that was the greatness of that man. And I'm so humbled that I have been chosen to say tributes to him. So to begin with, I would like to bring greetings from World Psychiatric Association and from International Psychiatry to this great man who is not your Wig, he is our Wig. He has been mentioned many times for his contributions. There is a long list. And this long list is not to get impressed by him. I feel this is a list to get motivated. This is a list for our trainees to know that how big he was, not only at a national level, but also at an international level. I still remember, and please correct me if I'm wrong, he was the first person to get the highest membership award of Royal College of Psychiatrists, honorary fellowship. He was rather the first person from this region who received this highest award. So that shows the greatness and the rich heritage of this great man. I just want to share this photo with you, which is full of emotions for me. As I said that, Professor Wig is not your Professor Wig. He is our Professor Wig. This is a facility in Lahore, and Param and Ajit visited Lahore, and we took him to that facility that we have named after his name. So this is a humble tribute to him from Pakistan to recognize his contributions. But I thought that I'll choose a topic which was very near to his heart. And I know that the previous orators, and there are many experts sitting in the audience who knows a lot about this topic. And there are so many issues that we can discuss under this topic. But I thought that I will take some of the areas which are more important in the 21st century. So please excuse me if I'm unable to include many areas that, in my view, are going to have a long-lasting impact in the practice of psychiatry in coming years. So I chose some of these areas that we have started facing in the 21st century. Just looking at Professor Wig's work, he was a man ahead of his time, and I have used this phrase from Professor Murthy's write-up, which he wrote as his obituary, that when he came in 60s, he looked at the community psychiatry. He talked about the liaison psychiatry, which was not even practiced in the West. So I thought that I'll just use some of the areas that are going to be of high importance for our future practice in the coming years. This is my disclosure. And I always start with this slide at such occasions, that is psychiatry different in 21st century? Yes, it is. And for example, this is an exciting time for us because psychiatry has moved from asylum to community and then now to homes. There are increasing awarenesses about mental health problems. We have got plenty of epidemiological studies showing different aspects of mental health. And 21st century has seen acknowledgements of scientific basis along with advances in genetics, investigations, and treatment approaches in mental health. But one thing which is very important and relevant to all of us in a big way, there is an increasing awareness by patients, carers, and users. And they are coming up as a strong stakeholder which is influencing our practice and our concepts. Current challenges we have been listening throughout this Congress. There are almost 25 to 30% of global population that suffer from one or another type of mental health problem. But undertreatment occurs even in the richest countries. And this is a norm rather than an exception. And then the limitations in funding resources are continuing to be a big challenge for psychiatry in the coming years. And then what has happened over the last few years? The added challenges, but at the same time, has given us some opportunities. COVID and mental health challenges, workplace well-being, comorbidities, digital care options, online services. These are the innovations in a way that are posing further challenges, but equally good opportunities to all of us. If we look at the WHO's World Mental Health Report, the problems, the issues, and the magnitude of difficulties with mental health is highlighted, especially for our region, South Asia. About 13.2% of the population live with the mental health condition. Treatment gaps for mental health condition in many countries in South Asian region is as high as 90%. We are still confronted with myths and associated stigma and discrimination. And the continuation of lack of trained professionals, lack of resources, stigma, discrimination, lack of prevention and promotion interventions continue to stay as important aspects and domains of the mental health scenario. So based on this dire need of these services, I'll try to emphasize on some of the points that I mentioned, will highlight that these points also need awareness, attention, acknowledgement by clinicians, by researchers, and by policymakers. So let's start with the urbanization and mental health. This is a universal phenomenon. But if you look at the 10 largest cities in the world, 6 are in Asia and 3 are in South Asian region. In India, you can see Delhi, Mumbai, of course, Tokyo, Dhaka, Shanghai. So we are paying the price of urbanization in a big way. But are we ready in terms of urbanization and its impact on mental health? These are some of the facts. Globally, more people are now living in urban areas. For example, the facts are that in 1950s, 30% of the world's population was urban. And by 2050, it will be plus 60%. Urbanization in Asia is one of the biggest problems. And continuing population growth and urbanization are projected to add 2.5 billion people to the world's urban population by 2050. And if we look at just 2 countries in Asia, India and China, together they are expected to account for plus 30% of the projected growth of the world's urban population. So this is a new thing, apart from neurotransmitters, that is adding a lot of thoughts to us about its link with the mental health. I'm sure all of you know that it is not a new phenomenon that urbanization and inner city areas were linked to the severe mental health problems back many, many decades ago. And right from that time, there was an interest of urbanicity and mental illnesses. So what is actually happening? Is it good for mental health to live in big cities? Or does it increase problems of day-to-day life in living in the urban cities? I will only concentrate on social disparities, social insecurities, pollution, lack of contact with nature are some of the recognized factors that affect urban mental health. And we are directly or indirectly becoming a victim of urbanization when it comes to the practice of mental health in our own places. And then a number of studies are now coming up, and they are emphasizing that the link with the nature, which we usually get through the green spaces, is also positively associated with positive well-being and negatively associated with mental distress, and along with green space visits associated with a lower likelihood of using medication for depression. So the evidence is coming up how this type of living, which is going to increase in coming years, will have an impact on the mental health. The ecological consequences of living in urban areas have also been documented, that extended exposure to artificial light in towns and cities, and they are naming it light pollution, affects a big number of North Americans and European population and is associated with increased risk of mental illness, such as mood disorders, including major depressive disorders. And crime victimization, low social cohesion, that explains again 20 to 25% of association between urban upbringing and increased risk of psychotic symptoms in children. And then, moving further, the environment and mental health, another hazard or another gift of the today's living. The contact and the links of nature with mental illnesses and mental health is now being explored in a very scientific way. And people are using these terms like ecosystem services. Worldwide, major efforts are underway to bring ecosystem services and their values into policy, finance, and management. And a growing body of empirical research is showing the value of nature experiences for mental health. This is in addition to prescribing drugs, psychotherapies. These areas are new for us as mental health professionals to look into. And then, of course, several aspects of contemporary lifestyles are associated with reduced routine natural contact. Contributing to a decrease in nature contact includes increased time spent indoors and on screens, and decreased outdoor recreational activities. Again, an important factor in emotional and mental health well-being. Similarly, investigators in public health and health economics have intensified their research on the role of nature contact and the environment as a general health promoter, including mental health. Similarly, a wealth of studies have demonstrated that nature has got an important role with psychological well-being. And these effects are very important in terms of our future practices. Geopsychiatry coming up as a new subspecialization or theme in the practice of psychiatry. World Psychiatric Association is mindful of this, and we are releasing a policy document in 10 days' time on geopsychiatry, climate change, and geopolitical determinants of mental health. This is a call to make it more clear to our professional colleagues that we have to come out of the neurotransmitters domain. We have to look at what are the other factors that can be used, prevented, or managed for our well-being. Aging is one of the best gifts of this new century. And age is a sort of a universal phenomenon. And we are having big number of older and elderly people as compared to 10 years ago, 20 years ago, or 50 years ago. The pace of population aging is much faster than in the past. And it is not only the high-income countries, even low and middle-income countries, as there is a longevity of life, unfortunately, at the expense of quality of life. And this is another area which is linked to the mental well-being, and we need to look at that. And it is occurring alongside broader social and economic changes, has got and going to be a big effect on economics. For example, if you get a chance to look at this paper, although it was published about 10 years ago, that the aging and its economic impact, especially in South Asia, is a big, big challenge for all of us. If you look at somebody who is age 60, he may be having one illness, he may be taking one type of medication. You go to 65, 2, 73. So it goes on with an increasing chronicity in terms of morbidities. And of course, that plays an important part in the mental well-being and psychological well-being, not only of that person, but also of his family or her family and the close relatives. There could be some variations in older people's health as genetics, but social environments also contribute a lot. Physical and social environments can affect health directly or through barriers or incentives that affect population. So these are another psychosocial domains that are coming up as important for our future consideration. As I mentioned, Asia is having an increasing aging population as well. The impact of aging could potentially drag down, for example, Japan's average annual GDP growth by 1 percentage point over the next 3 decades. So what does this mean? The working class people will be getting less and less. The younger people are less. Children are born less. The longevity of life is increasing and may have and would have a long-lasting impact on the economies. Another gift of this century: social media, virtual world, and mental health. Mohan Agashi ji is here. He is an expert on this. We are now finding this type of social interaction. We are not meeting, we are only seeing each other, but looking at our own social media devices. I'm sorry to say it, but we are living in a society that is looking down at their digital devices. This is something which all of us are experiencing. When you wake up in the morning, the first thing you touch or you just get access is your telephone. You start getting craving if you have not seen your mobile or the messages for some time. So does it? And these are some of the facts, the recent facts about the social media. These are the popular social media platforms: YouTube, TikTok, Instagram, Snapchat, Facebook. And there are a number of harmful effects: cyberbullying, and even the unstoppable social media user growth is leading to a number of disadvantages despite having many advantages. Technology-related mental health problems, addiction, problematic use, compulsive use, internet gaming disorders. There are many terms now getting into our classifications. And we are not only dealing with the conventional psychiatric disorders, we are also entering into an era that new disorders are coming and trying to get a place in our mind in terms of our future thinking. Just to give you an idea about internet addiction, China was one of the first countries to label internet addiction as a clinical disorder. You just take examples, published work from any country. This is one of the hot topics. There are eminent child and adolescent psychiatrists sitting here. I'm sure they are seeing more problem cases. Families, parents are coming that children are spending more time before these devices. So this is another challenge that we have almost started feeling and experiencing in this great century. Telepsychiatry. This was a blessing for us during the times of the COVID. Although we have to keep this in mind, the idea of video conferencing in assessment treatment with healthcare system is not a new one. It is 70, 80 years old when people started using these methods for healthcare systems. But during the course of COVID and even now post-COVID, we are continuously using, benefiting, and at times getting issues with the telepsychiatry. Telepsychiatry in particular is also raising some issues. There has been a number of studies from this part of the world that have shown a lot of good points and challenges related to the practice of telepsychiatry. But overall, cultural competency, medication prescribing, operating procedures and protocols are still need to be finalized. I'm so pleased that Indian Psychiatric Society was one of the first societies of WPA that produced guidelines about the use of telepsychiatry. I think these are the compulsions now coming up that our professionals need more awareness and issues which are related to the use of telepsychiatry. And it is not only seeing patients through telepsychiatry. The virtual teaching and training is another, again, advantage as well as a disadvantage. Many of countries in South Asia, they are encouraging clinicians to use virtual methods for clinical work as well as for teaching and training. And COVID-19 definitely had an impact on trainees, impact on educators, and impact on the general educational system. And in psychiatry, where during the last century we were told that the most important tool is empathy. Looking at the patient, seeing at the patient, talking with the patient. And now this is entirely a new scene. You are seeing the patient through your smartphone. So again, a different approach, a different ideas, and a different issue. Online education is now becoming a norm. It is not an exception. Even you must have seen that this very successful Congress has used online options, and there were many people who were able to attend that. So this is another area that is going to require attention from all of us. Some of the barriers that have been mentioned about e-learning. And that is another way of going forward, that now we are trying to identify the barriers and we are trying to correct our practices as per the e-learning processes. I think this has also impacted our curricula. In most of the countries now, it is not only the curriculum, it is the examination system. I have been an examiner with the Royal College of Psychiatrists for many years. I'm still unable to really comprehend that an actor is there and the candidate is examining the actor. But this is a norm now. So this has made a big impact in terms of our perceptions. And then these new methods, computer simulation, virtual patients, all these are new additions. And we who are living in this region are getting more influenced because technical advances are much more and easily available in these countries as compared to many other countries in the world. Just a commercial plug. The COVID-19 gave us a great opportunity to use this medium, and over the last 3 years, we have developed an educational portal on our website that has got more than 125 educational webinars, courses, and modules in 21st different languages. And I'm grateful to many Indian colleagues who have contributed to this type of educational initiative. Another issue, mental health as public mental health. Thanks to Dr. Basu for choosing the theme of this Congress as the public mental health. I think we are clinicians. We are trained as medical doctors. But I think psychiatry is a branch of medicine that is also open to a number of non-medical disciplines as well. And now we find that there are many other treatment opportunities that are beyond the drug treatment. And broader impacts of mental disorder, including work-related problems, financial issues, violence, victimization. All these issues may not need medical intervention all the time. So here is the public mental health, the population-based approach, the emphasis on promotion and prevention that is becoming one of the most important areas. We were not having that emphasis on these areas in the last century because most of our patients were living in asylums. So now as they are becoming a part of the general community, we have to look at all these areas in a more extensive way. Jonathan Campion is here. He has been delivering a number of talks here. He heads WPA's Action Plan Group on Public Mental Health. We have produced a number of papers which are easily readable by our trainees, that what is the importance of public mental health? What are the different ways public mental health can be conceptualized and can be practiced? So this is another area that is very important, especially for countries like ours in this region, where we will never ever have fundings, resources, or support by the government. Most of you know that 75% of mental health problems start before the age of 25, 50% before the age of 15. Mr. Malhotra can confirm that. These are the evidences. We do not need to treat these people with drugs. Prevention, promotion, school mental health, parenting, these are also appropriate interventions. And Here we need our other colleagues to support us. So this is a sort of a new aspect of psychiatry which is going to be present in the coming years. Working with stakeholders, especially with patients, carers, and of course with other professionals, non-medic professionals. I think this equation is becoming a hot topic in psychiatry. I always say that we hear about anti-psychiatry. Have you ever heard anti-diabetology, anti-cardiology, anti-orthopedic? Why? Because our physician colleagues have got a better liaison with their patients. Many of you who have attended the meetings, international meetings abroad, many times it happens that there are less people inside the hall, more people outside the hall raising slogans that don't go and listen to the killers. This is a fact. And the reason is we have not been trained to involve patients, carers, users, families in the treatment process. Of course, there are some issues. When you talk to some people, they say, well, look, this is an ethical and professional consideration. We cannot tell and share everything with the family. There are cultural issues. Family comes and family gives us the history. And then if you spend more time with patients' families, there are unexpected expectations from us. So they say that, hang on, we don't want to really go for that. WPA did a survey a few years ago, and we just asked our clinician colleagues that what do they think that, what are the issues that hinders our relationship with the patients. The top 31 was common: cultural issues, unrealistic expectations, ethical and professional considerations. Interestingly, the last two came up as eye-openers. Many said that we are not aware about this. We do not accept this. We do not have acknowledgement, but sadly, nobody has taught us the competencies of professionals dealing these issues have not been developed. So this is another challenge and issue that is going to be important in the coming years. So for this particular aspect, we need to have a meaningful participation of people. I'll give you one example of Royal College of Psychiatrists. I mean, that could be an extreme example. The trainees are taught and given some slots to the patients, carers, and users who come and teach them. I'm not sure that how many centers in our countries do that. In some countries, the trainees are asked to spend 24 hours with the family who is living with a chronic mentally ill. Then you will realize the magnitude of the problems. In many NHS trusts, rather all NHS trusts in UK, when you appoint a consultant, there is always a representative of carers, families, and the patients. These are the examples. We may not be able to follow all those, but I think the important thing is that this is what we need to promote and we need to think. Just asking one of the patient, coming and giving a talk to our trainees, doesn't involve any money, but that will give us more exposure. I remember one of my senior friends who has worked as professor in this country. He has a family member who suffers from dementia. And I can never forget what he said. He said that what I am experiencing now I realize the person who was sitting on the other side of the table when I was doing the consultation, he was going through that. I have only gone through that and realized that when I have gone through it. I think these are the real life experiences that are the need of the time. And this is just a sort of a small issue for our young trainees, for researchers, for budding academicians. We always go for this, that look, we are not represented in the research that is coming from high income countries. I think we will never get that. They will always have an upper hand. The grants come from those people. They have got more big names. Their names carry significance in terms of getting a publication. Why can't we run small consortiums of our neighboring countries and try to do some research? Professor Awasthi has done a lot of research with the professors from here in the PGI. I think that is the model that we have to really develop. Our cultural heritage, our problems, our issues, our service provisions are generally same. So rather than just doing a collaborative research with UK, US, or Australia, why can't we do the collaborative research within the region? Look at the population, look at the number of people. That will have a big impact when it will come into the global health journals, who will be then forced to consider the publications from our people. And last but not the least, we have to accept that as professionals, our role has changed. It is very difficult to accept a change. All of us are human beings. We find a lot of difficulty. Now, just to give you one example of this, the biggest role change, in my view, you may differ with it, or you may have better ideas than me. The biggest change in our practice is that now we are not talking about madness, we are talking about mental health. A big conceptual change. 20th century was dealing with madness. Mad, send him to asylum, out of sight, out of mind. Now, the conceptual framework of psychiatry and mental health is changing from madness to mental health. This is one major role change. The second change, the cost effectiveness and innovations and technologies and priorities. You go to a policy maker and say that, look, we need more psychiatrists. He will say, hang on, why not more cardiologists? But if you tell them that give us our share by the burden of disease. So this is a language which we have not learned. So this is another changing role. We need to have leadership training, a component of our postgraduate teaching. How to speak to these policy makers, how to convince them. So this is a sort of other thing. And we are actually seeing a change in the presentation. as compared to the 20th century in our patients, and that change is affecting or is going to affect our roles. For example, now there is a minority of people who are seen as presenting a danger primarily to society. And now this was the main people in 20th century, but now it is a minority. The minority in 20th century is now becoming majority, and that is a growing majority who are no threat to society, but who may harm themselves through neglect or poor judgment. A complete shift. So when people say that, well, medical students, we want to teach them psychiatry, we tell them what is psychosis, what is schizophrenia. I personally think that they should be told about anxiety, about OCD, about panic disorder. This is what they are going to see in the future. So I think we have to consider a shift in our roles depending on these changing patterns. And that is why we believe that we need to continue reviewing the role of psychiatrists and mental health professionals in the coming years. And this becomes even more relevant in our South Asian countries where we will never ever have enough psychiatrists. So, ladies and gentlemen, just to conclude, this is the slide that I showed you earlier. Believe me, this is an exciting time for mental health and psychiatry. Don't get disappointed. We are emerging as an important specialty. New advances, new technologies, new innovations, and new hopes. And if we are able to use other stakeholders, not only patient carers, families, also non-medic professionals working in mental health, we can make and deliver a big change. What we need to do is that we have to look at some of the conceptual changes and modify our practices as per those conceptual changes. Mental health during this century is dealing with misconceptions and stigmatization. It is promoting the rights of mentally ill, advocating for access to services, and improving public knowledge. These are the principles that we have to follow. And two things which are very important. Let's improve the image of mental health. Let's improve the image of mental health professionals. And the way forward is not that bleak. It's not that negative. But if we want to survive, we need to lobby for telling people, the government, the policymakers, that we want changes in services should be based on the needs, and changes in policies based as per burden of disease. And please, mental health needs to be evaluated on evidence, not on perception. You get a news if some murder has been done by a mentally ill. The press releases it like this, that all mentally ill are dangerous people. So please look at the evidence, not the perceptions. So dear friends, let's work together. And this is a humble suggestion, especially a center like PGI, that it would be useful to establish an independent and inclusive think tank in each prestigious institution. And that should include non-psychiatrists. That should include patients' representatives. And that think tank should really review what are the new innovations, what are the needs, what are the opportunities. Because if we just go what has been taught to us, sometimes we are left behind. This is a quote that I usually use from one of the past presidents of World Psychiatric Association, who is editor of WPA's journal World Psychiatry. And he wrote this editorial in 2010. And it says, if psychiatry is in a crisis, this is a development crisis. Our future is in our hands more than in those of our clients or of politicians. Let's stop blaming each other. Let's stop fighting with each other. And let's work together to upgrade the reality and the image of our profession. Thank you very much and hope to see you in Vienna.
Thank you so much, sir. I must say that the oration was quite insightful and it was deeply thought-provoking. May I now request Dr. Devika to present Momento. I request our Dean and our HOD, Dr. Basu, to present Momento to Dr. Afzal Javed, sir. Thank you, sir. I request Professor Basu to kindly propose a vote of thanks.
Thank you. Thank you very much, sir. I think it has been wonderful listening to this broad, comprehensive coverage, starting from the historical errors to the way forward. I don't think I'm going to summarize this talk again, but all we can say is that from here, we can get some directions to which we can take for our future message, all of us, including psychiatrists, other mental health professionals, and even people in the hall, senior faculty I know who are from other professions. So thanks a lot for everyone for coming here. First of all, to Dr. Afzal Javed sir, hamare mehman, and I also thank our Dean Academics, Professor Naresh Panda, for in their time. I extend my thanks to our seniors. I'm not individual taking names, please pardon me, because I don't want to miss out anyone, but I can see so many people here. So everyone, I particularly don't want to miss Siddharth, Wig, and Anand, who I can see sitting there. So thank you very much, both of you, for every year you are always there, and you know, so you're a part of this department. Thanks to all the other faculty members who are here. Thanks to all the delegates who are still here, some of them patiently surviving the last 3 days and, and still here, and all the registered delegates, the students, everyone. If I miss out anyone, please forgive me. Thanks a lot. Thank you.
I propose a standing ovation for Professor Afzal, Professor Basu, and his team.
Okay.
Thank you, sir. May we all rise for the national anthem. Thank you all. Kindly join us for a cup of tea at the LT foyer.